When a child or teenager is diagnosed with scoliosis, there are really only 3 treatment options available in the standard medical care. If the curves are less than 25 degrees, no treatment is needed. This is the watch and wait period to see if those curves are going to get larger over time. For curves that are over 25 degrees, hard bracing is typically recommended. However, it's not to correct the curves, but simply an attempt to prevent those curves from getting larger. For curves over 40 degrees, surgical fusion becomes the last and final treatment option recommended. Much of the new research regarding adolescent idiopathic scoliosis points to a neurohormonal cause. However, most of the current treatment options do not address that at all. These treatments continually focus on the passive forced correction, either by hard bracing or by surgical fusion, instead of the reactive neurological retraining that can reduce scoliotic curves using exercise and motion. The research shows that the traditional passive treatments have less than impressive outcomes. This has led many scoliosis doctors to find better treatment options, those that do not require hard bracing or surgical fusion procedures. That's where our treatment comes in. The main difference in our treatment is the acknowledgement that scoliosis is not simply a musculoskeletal disease. Rather, it is a neurological disease that manifests itself in the spine due to the brain's inability to maintain the body's position and orientation to gravity. So with a bracing treatment approach, you are immobilizing the spine when really the spine needs to be in motion. Or with a surgical fusion, you are straightening a spine and basically trading one deformity for another. You're taking a curved but flexible spine and moving it to a straightened but fused spine. Either way, you're not treating the underlying problems. Our program utilizes specialized therapies and treatments to restore the normal curves of the spine while reducing and stabilizing the abnormal curves. This process restores the brain's ability to maintain proper orientation to gravity, allowing for a long-term correction. Each patient's treatment is customized to their spine's 3-dimensional structure. We'll start with warm-ups to get the spine loose and moving better. We'll move into treatments that actually correct the spinal curvatures, and we'll finish with doing what we refer to as NMR, where these are the exercises to actually strengthen and to hold that new position. If you or someone you know is suffering with scoliosis, we would love to be able to provide the treatment you need. Please call us at 816-425-5578 or visit our website at scoliosiskc.com.